this video, we will discuss TURP, which stands for transurethral resection of the prostate. Gary is undergoing this operation to treat his bothersome waterwork symptoms.
Good morning, Gary. We are here to discuss your upcoming prostate surgery, and I am happy to answer any questions you might have.
Thank you, doctor. What does this procedure involve?
The prostate gland sits around your water pipe, which is called the urethra, as it leaves the bladder, and when it enlarges, it may block the flow of urine. TURP involves telescopic removal of the obstructing central part of the prostate with diathermy, electric current, creating a wide channel to allow urine to flow more easily. We usually insert a temporary bladder catheter at the end of the operation. Are there any alternatives to TURP? There are few alternatives. The first option is observation. This entails no treatment, but monitoring of any change in your symptoms. Symptoms can improve over time without any treatment, on the basis of 5 studies of the natural history of prostatism among men with moderate prostatism, who were followed for 5 years. Approximately 40% will improve, 45% will have no change in symptoms, and only 15% will have deterioration. Patients often trial some drugs to improve the urine flow. These include tamsulosin, finasteride, and dutasteride. Having said that, I could see that you are already on the maximum medical treatment. The second option is permanent catheterization, especially in patients who, for any reason, are not considered suitable for surgery. The third option is surgery, but you could choose another surgical procedure instead of TURP. The options include holmium laser enucleation of the prostate, HOLEP, green light laser prostatectomy, the Urolift procedure, rhizome steam ablation, and prostate arterial embolization. Occasionally, an open or keyhole robotic assistance procedure may be offered to you.
Thank you, doctor. How is the procedure actually done?
The procedure is normally done under general anesthetic, where you are asleep, or spinal anesthetic, where you are unable to feel anything from your waist down. You will be given an injection of antibiotics before the procedure, after you have been checked for any allergies. After that, a telescope is inserted into your bladder through the water pipe, and the central part of the prostate is removed a piece at a time using a diathermy loop. The prostate is removed in small pieces as shown in this video, evacuated from the bladder by suction, and the chippings are sent for pathology analysis. Once the prostate tissue has been removed, any bleeding points in the cavity left by the surgery are carefully cauterized as shown here.
What happens at the end of the surgery?
At the end of the surgery, a catheter is inserted into your bladder. Bladder irrigation is used in and out of the catheter to flush through any clots or bleeding. On average, the procedure takes between 45 to 60 minutes to complete.
How long do I need to stay in the hospital?
You should expect to be in hospital for 1 to 3 nights, although in some hospitals, the procedure is done as a day case.
Are there any after effects?
Almost all patients will have temporary mild burning, bleeding, and frequent urination. Up to 75% of patients will notice that no semen is produced because it passes back into the bladder on ejaculation. This is called retrograde ejaculation. There is 10 to 50% chance that the treatment may not relieve all your symptoms. The following after effects range from 5 to 10%. Poor erections in men with previously normal erections. Bleeding requiring a blood transfusion or reoperation. Possible need to repeat the treatment at a later date due to regrowth of the prostate. Injury to the urethra causing delayed scar formation. Inability to pass urine after surgery requiring a catheter or intermittent self-catheterization. Loss of urinary control, which may be temporary or permanent. Finding an unsuspected cancer in the removed tissue, which may need further treatment. The following after effects are rare, less than 2%. Irrigating fluids getting into the bloodstream causing confusion or heart problems. Anesthetic or cardiovascular problems possibly requiring intensive care, including chest infection, pulmonary embolus, stroke, deep vein thrombosis, heart attack, and death.
What can I expect when I get home?
You should drink twice as much fluid as you would normally for the first 24 to 48 hours to flush your system through and reduce the risk of infection. One patient in 5, 20%, gets some bleeding 10 to 14 days after getting home due to scabs separating from the cavity of the prostate. If this happens, you should increase your drinking. If it does not settle, you should contact your GP, who may need to prescribe antibiotics for you. If you have severe bleeding, past blood clots, or have sudden difficulty passing urine, you should contact your GP immediately. This may require readmission as an emergency. Some loss of control is common in the early days, so it is helpful to start pelvic floor exercises as soon as possible. These can improve your control when you get home. The symptoms of an overactive bladder, frequent and urgent urination, can take up to 3 months to settle, whereas the flow of urine is usually improved immediately.
When could I return to work?
Most patients need 2 to 3 weeks at home before they feel ready for work. We recommend 3 to 4 weeks rest before you go back to work. Especially if your job is physically demanding, you should avoid any heavy lifting during the recovery period.
Thank you very much, doctor, for this helpful information. I feel that I am now ready to have my prostate operation, having had all my questions fully answered.
I hope you found this video educational. For more future videos, please consider liking and sharing this video, as well as subscribing to the channel to help it grow.